Elizabeth Merrick's medical story started several years ago with excruciating headaches when she was pregnant with her first child. The headaches came back during her second pregnancy, and that's when they found the tumor.
So it was about the size of my fist.
Wow. She had brain cancer, glioblastoma. Most people who get it don't live very long. Her doctor at the Siteman Cancer Center is David Tran.
The tumor, the regional tumor was actually encompassed the whole regions here.
Doctors needed to operate, but they also wanted the pregnancy to get as close to full term as possible, so they waited and closely monitored the baby and the potentially deadly tumor.
To tell you the truth, it was a very difficult 3 months while we were seeing her, planning all the treatments with the baby growing inside her. And there's a tumor that we know is aggressive, and we have to balance.
I don't remember. She went in on a Friday 2 or 3 days.
When she finally went in for surgery, still carrying the unborn baby, Ray Merrick wasn't sure if either of them would survive.
It's on this side. Yeah. It goes from here all the way around down.
But the plan worked. The surgery was successful. Their baby daughter was delivered. Elizabeth's cancer battle, that was far from over.
I found out that I was going to have to do chemotherapy and radiation.
There's always the possibility in these cases that the cancer will come back. The tumor will begin to grow. And it did.
This is the recurrent tumor right here.
Yeah. And here's where the story takes a twist. We met Elizabeth and Ray at the Siteman Cancer Center to find out about an experimental treatment that looks like it might have come out of the lab of a mad scientist. And it's probably keeping Elizabeth Merrick alive.
Whenever my hair starts to get too long, it'll start shocking me, and that's when I need to change my arrays and reshave my head. So
its brand name is Optune. The device is made by the Novacure company, and Siteman is part of the studies and trials on its effectiveness. Elizabeth wears these things on her head most of the day and night. Ray has learned to change them out. They're connected to a battery pack and create an electromagnetic field. If you think that sounds kind of wacky, you're not alone. There were plenty of experts who had to be convinced.
So, but at the beginning, I was quite skeptical. I was never trained to think that an electric field could actually do something like this. Given the fact that we have very few options for these patients, that I was willing to give it a try.
Cancer is made up of out-of-control cells that rapidly divide. That division, or mitosis, duplicates and equally divides the genes on what's called spindles. Turns out these spindles have an electrical charge, positive and negative ends. And if you can, let's say, jam the frequency with what Novacure calls TTF, or tumor-treating fields, the cancer tumor cells go haywire.
You basically disrupt the whole process, and this tract can no longer form. It basically ends up not being able to complete the divisions and undergo cell death. So they actually die. So the device actually kills the cells.
They come to the Siteman Cancer Center periodically so data from the device can be downloaded for analysis by Novacure. For many patients, trials show this treatment can slow the growth of a tumor, extending their lives, but only perhaps for a few more months. Elizabeth has been wearing this device for a year, and her tumor has shrunk to nearly nothing. She is only 33, with 2 kids at home. Not only lucky to be alive, but lucky to be talking about the long-term prognosis.
So, it's difficult to use the word cure for these types of cancer, but I would venture to use the word, if I may, is to convert into chronic disease. And that's what we're trying to do.
And here's the recurring theme in cancer treatments. What works on one cancer, one patient, doesn't necessarily work on another. Cancer's not a single disease, but a lot of different diseases, and that's even true about brain tumors. An effective treatment becomes another tool. The trick is finding the right tool for the job and finding efficient ways to match the treatment to the individual patient and the individual cancer.
So I think the key right now in the field is to identify those patients who benefit from any therapy, including this therapy, and perhaps at some point in the future is that we can actually speak in a very intelligent manner that, you know, Mrs. Elizabeth has this tumor with the particular types of mutations in her tumors, that perhaps novel TTF is the best option for her, and then the next best option is X, Y, and Z. Are we there yet? No, but you know, my prediction that we're not very far from that.